We worked on a policy brief looking at how to target testing at children who need to be tested for HIV. And through the policy, we found that there were two ways in order to improve this. One was using a validated screening tool, and the other was empowering healthcare workers to test children. So in South Africa, we have almost 100,000 children who are living with HIV but are not on ARVs. And these children are at risk of HIV-related complications. So many of them are older, many of them are between 5 and 14 years old, and this means that they don't actually get routinely tested at our health facilities. So what we aimed to do with this policy was find a way to improve the numbers of children who need to be tested, who get HIV testing at our health facilities in South Africa. The structure of the data to policy courses was done in a way that you build on each subsequent session. Initially, you do a literature review, trying to understand the problem. Eventually, you're doing costing and effectiveness analyses. And in the end, you build your policy. And so this step-by-step process was very helpful in trying to develop recommendations that could be implemented countrywide. So following the forum where we were able to present our work, there have been lots of discussions with the Department of Health about implementation of the policy, and both recommendations are actually being taken up. One is that the validated screening tool is being scaled up countrywide, and the other is that healthcare workers are currently being capacitated to do disclosure and adherence counselling in children so that they can better test children for HIV. As an HIV specialist in pediatrics, I have been involved in policy development with Department of Health for almost 10 years. And until this point, I didn't really understand how to build a policy and how to make evidence-based recommendations. So how to take something that is scientifically proven to work, but then look at it in a real-world environment, a real-world setting where we've got costing and we've got other impacted factors and indirectly affects other areas. So I think this course is particularly helpful for anyone working in the public health domain to just better understand how to build a policy. We can make a difference if we go through due process and we follow, making sure that we follow all the steps and we get evidence-based recommendations, that these can be well accepted by our Department of Health and other policy makers and can actually lead to a difference in how things are done.